Okay, hi everyone. I'm Jodhpal Singh, Dr. Jodhpal Singh, and I usually just go by Joe. So thank you for joining me today. This is the first video on my YouTube channel. I'm gonna be discussing, topics and research areas that I had been engaged in while I was a graduate student in graduate school in Saskatchewan, Canada. And a big focus of mine when I was in graduate school was on sport-related concussions, mild traumatic brain injuries, and how cardiovascular functioning or how the heart is stressed following a hit to the head. Now, when I joined this lab, they already had quite a bit of concussion research ongoing, and they already started to look at the heart. But what we really tried to do together is focus on a mechanism to identify, okay, well, what actually happens to the heart when you take a hit to the head? And a big topic I want to discuss is this recent article that we as a lab had published that focuses on, the cardiovascular function or the mechanism that might come into play when you take a hit to the head. So we'll dive deep into that, and of course, I'm going to be putting all the articles that we discuss here in the link as well. Okay, so now, everyone thinks they understand or they know what a concussion is. When you watch TSN or sports games, you tend to see something called sport-related concussions happen quite often. So if you see football, a lot of these guys will take a huge hit to the head, or in soccer when, they try to head the ball and it misconnects, and that could lead to quite a few injuries. So those are termed sport-related concussions. But really, even outside of sport, like in a workplace, or let's say you're driving, for example, and you end up in a vehicle collision or an accident, that could lead to a whiplash occurring, and a whiplash can also lead to concussion-like symptoms as well. So from that perspective, if you were to technically define a concussion, you could call it a transmission of biomechanical forces. It could be either direct, something like in a sport, or indirect, for example, whiplash in a car accident. And if the damage occurs to the head, this usually leads to a spectrum of clinical signs and symptoms. So, because of the spectrum and the large variety of symptoms, it's important that everyone understands that not all concussion symptoms are the same. Because of that, it can lead to different psychological and physiological manifestations as well. And not only that, but because concussions and mild traumatic brain injuries, they depend so much on, what the initial assault or insult of the injury was, that becomes really important to have in sports, for example, a sideline physician who can see everything that's occurring, or healthcare worker who could see everything that's occurring and then deal with the patient accordingly, manage their treatment specific to them and make it very personalized in that sense as well. There used to be a belief that a lot of patients, or generally patients, recover within 7 to 10 days following the injury, but we're now starting to see that it's not always the case. What happens is a lot of the psychological or even physiological manifestations don't resolve within that 7 to 10 day time span. And many of the current assessments that we have, they're very basic memory tests, symptom checklists, exercising protocols, and they have a lot of clinical utility, but they're not always the most accurate or reliable assessments. And with our lab, what we try to do is focus more on the autonomic nervous system. So, can we measure your heart and brain function and see, is there an objective way to identify if you've returned back to normal? And it's not just an acute concussion, acute meaning, within 7 to 10 days, of course, but also if you look at post-concussion syndrome. So, with the work that I did in graduate school, we saw a lot of individuals who, it's been 10, 15, 20 years even, where they're still having so many symptoms, and there's just no way to resolve any of them. Or even if there is a way to resolve the symptoms, there's other problems that often come with that. So with post-concussion syndrome, it's an interesting area where again, some of these individuals, their stories are incredible. Like some of them used to play, for example, rugby or football. They used to take a hit to the head, get knocked out, go on the sideline, and as soon as they woke up, or they got back up, they were tossed back in. And it just created a large vulnerability for further injury to occur as well. Um, so even with post-concussion syndrome, we tend to see that there's long withstanding physiological problems as well. Their heart and brain aren't functioning the exact same as you'd expect to see in those without a history of brain injuries. And we do definitely consider that with the autonomic nervous system mechanisms as well. Oh. Okay, so now a big thing to consider here is that a concussion might occur due to trauma to the brain, but it's important to note that the extent of the injury is not localized to the brain. What happens is a hit to the head can essentially lead to stress around your entire body. Okay, so we can call this physiological stress. And it's essentially a response by your body to maintain some sense of homeostasis or normalcy, even after the autonomic dysfunction that occurs due to the concussion. If you induce a mild traumatic brain injury, this can lead to a cascade of different events. So, in the literature, we call this neurometabolic cascade. And essentially, what happens is you get a release of something called glutamate, a large release of it, into synapses between the neurons. And this is followed by an influx of calcium and sodium. Influx essentially meaning you get a big entry of things like calcium, and you get an efflux of potassium. So you get a removal of potassium, and this occurs in such a large amount, and especially with the amount of calcium that's coming in. There's such a high level of action potential propagation. So your brain becomes so nutrient demanding, and essentially you end up almost like in an energy crisis at the brain. And really, the amount of blood and nutrients that are being given to your brain is uncoupled, or it's not matching the amount that's required. So this metabolic demand that you tend to see leads to an impairment in something called neurovascular coupling. It's an interesting mechanism. Now, the excessive stress that the body induces might be causing some of this neurovascular uncoupling. You tend to see a lot of problems with some other mechanisms, so things like blood pressure regulation, dynamic autoregulation. We'll get into that a little bit as well. And cerebrovascular reactivity, so how your brain is responding to different stimuli. All these different mechanisms tend to get impaired. And it seems to be due to a large amount of stress on the whole body rather than just the brain itself. What's interesting as well is, in order to try and fight off some of this complication that occurs from the concussion, there's a big inflammatory response. Now, if that inflammatory response is not dealt with, it can become chronic over time. And, you tend to see this a lot in patients with post-concussion syndrome. Like, they tend to have chronic inflammation, and that leads to impairments in different parts of their brains, the way they communicate with each other. And really, with the stress being so whole body rather than just purely localized to the brain, we tend to see a problem between the way the heart and the brain communicate with each other. So this is called a heart-brain axis. And with a concussion, you tend to see a impairment in the functioning between the heart and the brain axis. It's an area that requires a lot of research still, for sure, but what's interesting is, it's a key point because we start to now consider the cardiovascular system as an area for treatment when we're trying to treat concussion or concussion symptoms as a whole as well.